All right, we got a healthcare scramble going on, don't we? South Carolina Senator Tim Scott was visiting earlier talking about what goes in and out of this. I want you to listen very carefully to the needle he was threading on Texas. In other words, you are telling those who are leery about that, we'll address this with the tax reform measure, maybe remove it then?
Absolutely. There's an opportunity for us to gain momentum through the passing of this health care legislation and then have a conversation and then hopefully tax reform that includes dealing with those taxes that we have not dealt with in the health care bill.
All right, did you catch that? It was actually a brilliant negotiating point, but I do want to raise with my next guest, Texas Republican Congressman Brian Babin. And Congressman, always good to have you. But what it seemed the senator was saying was this, all right, for you conservatives not very happy about swallowing, keeping it two key taxes in the health care law in place, relax, we can rescind them later in the tax reform package we cook up. I'm kind of cutting to the chase. What do you make of that?
You know, I interpret that statement just like you did, Neil. Of course, the thought of keeping these ObamaCare taxes just doesn't sit well with me. You know, the biggest problem of not only the taxes but the insurance regulations, the insurance mandates, as much of this thing as we can repeal and replace, the better off we're going to be. That's just a simple fact.
But you worry, though, Congressman, and I understand it's actually a very smart negotiating point. But for moderate colleagues of yours in the House, if it ever gets back to you guys, or in the Senate, they might say, well, wait a minute, this is the means by which you wanted to keep more Medicaid available, and now you might be pulling the rug out from under that later. I could definitely see the method to it, but you see my point that then moderates who sign on to this will say, wait a minute.
Well, you know what? I'm not a moderate. I'm a conservative. So I want to see, I would love to have a clean repeal, obviously. That's not going to happen. We've done our job in the House of Representatives. We've sent it to the Senate, and I'm optimistic. I think we're going to get to a point here that we'll have something that we can look at. I'm in favor of Senator Cruz's amendment, which will give freedom and you know, the ability for Americans to choose a plan that doesn't have all the essential health benefits and some of these insurance regs. Why does a 25-year-old man need maternity insurance? Why does every family have to have drug rehab coverage? That's just absurd. And so if the more that we can get rid of, the better off we're going to be.
Are you confident that this can get done?
Well, I'm not going to say I'm super confident, but I'm relatively optimistic because you know what, Neil, we've been campaigning on this for 7.5 years.
Absolutely.
This thing is going down. Half of the insurance companies that were insurers are now gone. 1/3 of the country doesn't even have but one choice. This thing is in a death spiral. Pretty soon, no one's going to have coverage. The past president told us that, you know, if you liked your doctor, if you liked your policy, you could keep them both. None of that's happened, and there's a lot of fear mongering going on. So I would just ask the listeners and viewers out there, don't pay too much attention to what you're hearing on the mainstream media. Unless it's Fox News, let's put it like that.
Or Fox Business. Congressman, thank you. It's always good seeing you.
You bet. Thank you, Neil.